Hello, esteemed faculty. My name is Dain Dastrup. Thank you for taking the time to consider my application to your CRNA program. Probably my biggest challenge I've overcome in my life was undergoing a kidney transplant while finishing nursing school. It all started in January, my final semester, when a routine doctor's visit found that I had abnormally high blood pressure and labs showed I was in end-stage renal disease. Despite the shock and challenges that occurred, I was able to complete my nursing program and May 9th that year graduated. On May 22nd, a few short weeks later, I underwent renal transplant. Shortly after that, I passed NCLEX and started my career as an ICU nurse. The experience taught me resilience, perseverance, and staying committed to my goals can overcome any obstacles that may come my way. It taught me how to stay focused on the task at hand despite outside distractions. It also gave me a really unique perspective as both a patient and as a nurse. I know that we deal with some of our patients on the scariest, worst days of their life, and I believe this experience has given me more compassion and empathy for my patients and really shaped the nurse that I am today. While going through my diagnosis, I also had two experiences that really shaped my career and led me towards the CRNA route. I was undergoing clinical hours with the CRNA, as well as completing my preceptorship in the ICU. Both nurses I was dealing with were some of the most impressive I had met to that point. Their technical experience, calm leadership, even under critical situations, really drove home to me where I wanted to be with my own career. First time I got a chance to really experience that high-level nursing of controlling hemodynamics, balancing sedation, analgesia, all while supporting my patient's respiratory drive, I was hooked. I knew that's what I wanted to do, that's where I wanted to be. Some of my things I love now about my career are running procedural sedation, post-op recovery for my patients, working closely with physicians in order to overcome critical situations and provide the best outcome for my patient is why I love nursing and why I'm continuing this path here. My ICU preceptor at the time also went on to become a CRNA, so that also drove home to me where great ICU nurses can step forward to advance their skills. In regards to how I would do in an online program, with 9 years of nursing experience, I've recently had to retake some classes that are going to be current for a CRNA program. So I'm familiar with an online format. I'm familiar with working independently to complete deadlines, and I don't think that would be a challenge for me. During nursing school, I also was mostly at a satellite campus, so a lot of our classes were virtual classes, were online. So I am familiar with the technology, I'm familiar with the challenges that would bring, and I feel like I would be able to excel in a hybrid program such as this.